Hi, everyone. It's Dr. Jen. Welcome back to the Integrative Health Podcast with Dr. Jen. Today, we're going to be talking all about Graves' disease with Dr. Eric Osansky. He is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has over 20 years of experience in health and wellness and has been helping people with thyroid and autoimmune thyroid conditions since 2009. He's the author of the books, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, The Hyperthyroid Healing Diet, and Hashimoto's Triggers, and is the host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed in 2028 with Graves' disease, and after seeing how well a natural treatment approach helped with his condition, he began helping others with different types of thyroid and autoimmune conditions, including hyperthyroidisms and Graves' disease, and hypothyroidisms and Hashimoto's thyroiditis. Welcome, Dr. Eric. How are you today?
Hey, pretty good, Dr. Jen. How are you? Thank you for having me.
Yes. I'm on my treadmill, so I'm like, whew, might get a little winded. No, I'm just kidding. So I love when doctors become passionate about a certain disease because they've went through it, because then you are there with your patients. You're like, I know how you feel. So tell us a little bit about your diagnosis with Graves' disease in 2008.
Yeah, so what was happening is I was a little bit overweight at the time, so I was dieting, I was working out, and it was helping. I was losing weight, and eventually the weight loss became extreme, which honestly I just thought maybe it was related to what I was doing. I wasn't honestly concerned, but one day I was walking in a retail store, specifically Sam's Club, and they have those automated blood pressure machines, and I took my blood pressure, which was normal, but my resting heart rate was elevated. It was 90, which was high for anybody, and definitely for me. So the next few days, I would just manually measure my heart rate, and it was anywhere between 90 and 110, and then just kind of put in the pieces together with the weight loss and increased appetite, again, which I attributed to dieting and detoxifying. But eventually, I did see a doctor, had some blood tests run, was diagnosed with hyperthyroidism initially, then went to an endocrinologist and was diagnosed with Graves. And I was new to hyperthyroidism at the time. I didn't have any experience, but I did attend some functional endocrinology conferences prior to that, just nutritional seminars where they focused on thyroid health essentially, and they very briefly spoke about hyperthyroidism, but most of it focused on hypothyroidism, Hashimoto's. But they did speak a little bit about hyperthyroidism, so I knew that there was a potential to address this naturally. And so, long story short, I decided I was going to take that natural treatment approach, and it helped me get into remission. And so far, knock on wood, hopefully continue to stay in remission since 2009. And since then, I've been helping others with hyperthyroidism as well as those with Hashimoto's.
That is super awesome. And how were the doctors when you told them that you were not going to take, radioactive iodine and you weren't going to go on methimazole? Like, how did that go? What did they say to you?
Well, they didn't say anything because I didn't give them the chance. I mean, I pretty much went to my primary care doctor, just got diagnosed with hyperthyroidism. He did write a prescription, I think just for a beta blocker. I think it wasn't until I got one to the endocrinologist that she recommended the antithyroid med. So I didn't take the beta blocker, but I didn't say that I wasn't going to take it. I just listened to what the doctor had to say. And then with the endocrinologist, I just had a single appointment. She actually didn't recommend radioactive iodine or surgery. She was actually a little bit more conservative than the average endocrinologist. So she just recommended methimazole, which is the most commonly prescribed antithyroid medication. I didn't tell her I wasn't going to take it. And again, I just to let people know, I work with people who do take the antithyroid medication. So I'm not saying there's not a time and place for it, but there are natural approaches, and I figured I'd give the natural approach a try. But I knew there was only going to be one appointment with the endocrinologist in all likelihood. So I just figured, what's the use of telling her? I didn't even tell her my background. I just got the diagnosis, And I did ask her for an ultrasound, got an ultrasound, a thyroid ultrasound during the appointment, but that was the only time I ever saw her.
Yeah, sometimes I go incognito also. It's
Yeah.
hard though. It's really hard. But and I hate it
Yeah.
when like when you go to a doctor and it says, "What's your occupation?" And I'm like, "Ah, no, I want to be incognito." Just kidding. Um,
Yeah.
so what is the difference between hypothyroidism, usually caused by Hashimoto's, and hyperthyroidism, usually caused by Graves' disease?
Yes. Great question. So hypothyroidism, excuse me, hypothyroidism is when you have low thyroid hormone. So you have T3, T4, the main hormones, at least the ones that could be measured. There's also T1, T2, which still don't know a lot about, even though there are now T2 supplements. But typically we're measuring T3, T4. So if someone has overt hypothyroidism, and what I mean by that is some people are subclinical, where the thyroid hormones actually are normal, but TSH is high. So TSH, thyroid stimulating hormone, that's a pituitary hormone. And that when the case of hypothyroidism, we got elevated TSH, low T3, T4. And the reason why TSH is elevated is because it's trying to signal to the thyroid gland to produce more thyroid hormone. Hyperthyroidism is the opposite. You have elevated T3, elevated T4, and because of this, the pituitary gland is trying to signal to the thyroid gland not to produce any thyroid hormone, and so you have very low amounts of TSH, very low amounts of thyroid stimulating hormone, and so that's the main difference between hypo and hyper. And then with Graves and Hashimoto's, you have different autoantibodies. So, like you said, most cases of hypothyroidism are caused by Hashimoto's, where you have the immune system damaging the thyroid gland. And typically, the antibodies associated with Hashimoto's, you have thyroglobulin antibodies, and then you have TPO or thyroid peroxidase antibodies. And with Graves, you have the immune system stimulating the TSH receptors of the thyroid gland, which leads to the excess production of thyroid hormone. And with Graves, you have thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. And it's also important to mention that people could have more than one antibody. So people could have all three antibodies. There are people I see who have the TSI, the thyroid stimulating immunoglobulins associated with Graves, but then also have thyroid peroxidase and or thyroglobulin antibodies.
Yeah, it's really fun when they all are positive and you're like, ah, but I mean, it can happen and they can swing between hyper and hypo and they'll let you know. I mean, the patients will let you know. They know their body, which is great. So what are some common symptoms with Graves' disease? You mentioned the really excessive weight loss can be one of them and the heart rate. And how do they differ from a Hashimoto's?
Yeah, so yeah, as you mentioned and as I mentioned, so weight loss is more common with hyperthyroidism, increased appetite, increased resting heart rate, heart palpitations, tremors, anxiety is pretty common with hyperthyroidism, insomnia, hair loss. So again, a lot of different symptoms, loose stools even. So with hypothyroidism, you get that, whereas with hyperthyroidism, you get that increased metabolism. With hypothyroidism, you have the opposite, of slowing of the metabolism. So typically you'll get fatigue, you'll get weight gain instead of weight loss. You might get brain fog, you'll get coldness is pretty common. Brittle hair is pretty common. Constipation, whereas I mentioned with hyperthyroidism, a lot of times you'll get the loose stools, increased frequency of bowel movements. And I mean, sometimes the symptoms aren't consistent with the condition, meaning that sometimes we'll have people with hyperthyroidism who are gaining weight. And again, there are numerous reasons for that, but most of the time you could go by symptoms. And then obviously with hypothyroidism, Hashimoto's, there are other factors that can cause weight gain. There are other factors that can cause fatigue. So just because you have fatigue and other symptoms associated with hypothyroidism doesn't mean, I mean, it could be adrenal problem, could be something else. But yeah, those are typically the difference in the symptoms between hyper and hypothyroidism.
Yeah, and I'll never forget this one patient. She just had back pain and weight loss. Now, she was kind of not sad about the weight loss, but she was like worried because it was very excessive and she had low back pain. So she reached out to me and I pulled the thyroid labs and I'm like, you have hyperthyroidism. And it was interesting because hers was induced by the COVID. So she
Hmm.
had the virus and she had that reactive thyroiditis, which
Yep.
caused her to be hyper. And I treated her, with low dose naltrexone and ivermectin, and we watched. Sometimes steroids are used with these, but we were calming down the inflammation with some botanicals instead. So, and her thyroid recovered, it did fine, but lots of little nuances. So, yes, rapid weight loss. While some people, well, with the semi-glutide, now we see that a lot, but you really have to make sure that you're really dialing down on your symptoms, and certain things can trigger this, like a virus, like gut
Yeah.
health. So, you really have to make sure you're listening to your body and then going to a functional or integrative doctor, because conventional medicine will sometimes miss this. They'll miss the autoimmunity because they'll just be ordering a TSH. So let's dive in a little bit more to the thyroid labs, because when we ask for a thyroid panel, what is the doctor going to usually order? Just a TSH. And that's not good enough, right? So Dr. Eric, let us know what we should be getting.
Yeah, sure. So yeah, definitely want to do more than just TSH, which again is that pituitary hormone. We want to look at the thyroid hormones. So there's the free hormones and there's the total hormones. I think with hyperthyroidism, it's okay to just look at the free hormones, free T3, free T4. For hypothyroidism, there's an argument to do both. Many don't do both, and I think even if you just do free T3, free T4 for hypothyroidism Hashimoto's, there's value, but the total T4, most of the thyroid hormone is actually bound to a protein. Only a small percentage is free. So when dealing with hypothyroidism and damage to the thyroid gland, sometimes it can be beneficial to look at the total output of thyroid hormone by the thyroid gland and look at the total T4 and total T3. And then there's also reverse T3. So reverse T3, let's cover what T3 is. So T3 is the active form of thyroid hormone. Most of T3 is produced by the conversion of T4 into T3. And you have what's called reverse T3, which is the inactive form of T4. So whereas again, free T3 is the active form of thyroid hormone. And so it kind of looks to slow things down. So if you have like a conversion problems converting T4 to T3, you might see that elevated reverse T3. Now, I will say with hyperthyroidism, I do not test reverse T3 because reverse T3 is almost always elevated in hyperthyroidism. So it's really not giving me any information that's helpful. So, and those with hypothyroidism Hashimoto's, I think reverse T3 can be helpful, not as much with hyperthyroidism. And then there's those antibodies that we mentioned. So you're right. There are some doctors that don't do anything when it comes to testing for the antibodies. And especially with hypothyroidism Hashimoto's, part of the reason is because their treatment won't differ. Pretty much thyroid hormone replacement will be the recommendation, regardless of whether someone has the antibodies. But yeah, you're right. You're absolutely right. We want to know, is there an autoimmune component? Because from a functional medicine perspective, we want to do things to find and remove triggers, heal the gut, correct underlying imbalances. So we want to look at those antibodies, those thyroglobulin antibodies I mentioned earlier, those TPO or thyroid peroxidase antibodies. And then in the case of Graves, there's those TSI, thyroid stimulating immunoglobulins. And I will say more times than not in hyperthyroidism, they will look at the antibodies just because you mentioned before, like an example of thyroiditis, like there's subacute thyroiditis caused by viruses. And so many times they will look at antibodies to see if there is that autoimmune component or if it's just going to be transient due to thyroiditis. But then sometimes I'll do what's called the radioactive iodine uptake test, where they will give a small amount of radioactive iodine. And if the value is really high, if the thyroid uptakes a lot of that radioactive iodine, then that could be diagnostic of Graves' disease. I can't say I love that test. I mean, if someone does the antibodies and it's positive, then there's really not much of a need to do that test, even though they will say to look at nodules. But you could do a thyroid ultrasound that also will tell if there's nodules and give characteristics to see if it's potentially malignant or not. But yeah, so you want to look at the TSH, thyroid hormone, T3, T4, some cases reverse T3, and definitely want to look at those antibodies. And then obviously there's other tests, not just the thyroid, but I think you just wanted to focus on the thyroid panels and antibodies here, right?
Yeah, absolutely. And they can write all those down and be like, I want a complete thyroid panel,
Yes,
because it's complete means different things depending on the training. So you want to be very specific and write it all down and hand it to your doctor. And if your doctor won't order them, now there's a lot of different online lab places that you can order labs yourself. You just won't get insurance coverage on it. So.
exactly. Yeah.
So, what exactly causes thyroid autoimmunity? I feel like we are seeing so much more autoimmune disease.
Yeah, that is true. And there's numerous factors for that. I mean, you mentioned COVID a few years ago. So we saw not only thyroiditis, but it actually did increase the incidence of Graves and in some cases Hashimoto's as well. But yeah, let's talk about some of the causes. So there's what's called the triad of autoimmunity, also known as the three-legged stool of autoimmunity. And according to this triad, there are three components necessary for autoimmunity to develop. Now, the first one is a genetic predisposition. And unfortunately, we can't change our genes, but we can modify the expression of our genes. And sometimes we don't know of family history. Like I dealt with Graves, but there was nobody I know of in my family who had a history of Graves' disease. So it does seem like there's a genetic component, but again, that doesn't mean that there'll be an obvious obvious family history. But there's genetics. That's second component of the triad of autoimmunity is one or more environmental triggers. And different examples of triggers could be certain foods such as gluten, stress even could be a trigger, environmental toxins, and arguably environmental toxins are a big reason for the increased prevalence of autoimmunity. Just that's unfortunately getting worse and worse. And then in certain infections, so we mentioned viruses, but you could have gut infections as well. You could have stealth infections such as Lyme disease. And then the third component of the triad of autoimmunity is that increase in intestinal permeability, which is also known as a leaky gut. And so most of the immune system cells are located in the gut. So you need a healthy gut to have a healthy immune system. And so the good news is that we could address the triggers. We could find or remove those triggers. We could do things to heal the gut. And by removing triggers, healing the gut, we could reverse that autoimmune component. Now, is it a cure? I mean, that's debatable. I mean, because there's that genetic component. I don't like using the word cure, even though honestly, I feel like I've been cured. Like 15 years have gone by since I dealt with Graves. I've had scares where I thought I might relapse, like I did have chronic Lyme disease in 2018, and thought that might lead to a relapse, and thankfully it didn't. But yeah, I mean, definitely it is possible to find and remove those triggers, heal the gut, and by doing that, get those balance the thyroid hormones, get those antibodies to a healthy level, to a normal level, and that's what I strive to do, and that's what, of course, you do as well with your autoimmune patients.
Yeah. And I always tell my patients or anyone that will listen, if you have one autoimmune disease, and you're not fixing the root cause, something else, whether it's another autoimmune disease, hormone imbalance, cancer, something else is going to sprout up like weeds, like you got to get to the root cause or they're going to grow back or something else will grow. So it's very important to look for those root causes and not just do what conventional medicine does, is band-aid it, unfortunately. Now,
Agreed.
yeah, it can be frustrating. So, what are what diet do you recommend to those with Graves and Hashimoto's?
Yeah, I mean, it's a great question. I mean, I think we both probably would agree that there's not a single diet that perfectly fits everyone. I do like autoimmune paleo as well as I like regular paleo too. Regular paleo is a pretty healthy diet. So I do usually recommend an AIP or autoimmune paleo diet to my Graves and Hashimoto's patients if they are willing to follow it, if because again, we don't want someone to be stressed out about the diet. So if they're used to eating fast food and refined foods and sugars, you might just have to start with, let's just eat whole healthy foods, try to incorporate more vegetables. So it really does depend on the person. But I do, if someone's willing to follow AIP diet for, I mean, ideally, I would say a few months, but even if it's 30 days, sometimes it's a mental game. A lot of times it's a mental game. Let's start with 30 days, or let's start with a week or two, see how you do. And many times they'll do fine. And again, if they're struggling, maybe a regular paleo diet, for example, is a better fit, or a modified paleo diet. So again, the type of diet differs, even though, like I said, I think of AIP diet as a good starting point uh, because it's a type of elimination diet. But the most important things: whole, healthy foods. Try to eat organic whenever you can. Try to minimize refined foods and sugars. Ideally, cut that out, at least while healing. Definitely avoid things like gluten, and I do recommend avoiding dairy. And so yeah, just again, as we both know, if you have 10 different practitioners, we'll all have different perspectives when it comes to diet. But I think we all would agree, let's avoid the refined foods. Let's avoid the sugars. Let's avoid the unhealthy oils. Let's try to avoid the GMOs. So if you get 10 functional medicine practitioners, we'll all agree on at least some of the basics, and agree that a whole healthy diet is important. And what's crazy, and you know this as well, most medical doctors will dismiss diet. You go, I mean, I don't know how many times I've heard where a patient brought up diet to their medical doctor or endocrinologist, and the endocrinologist, for example, is like, no, diet has no impact on whether it's Graves or Hashimoto's or other autoimmune conditions. And thankfully, those people are working with me, so they know better. But unfortunately, there are a lot of other people who don't know better, and they probably take the word of their doctor and figure, hey, diet's not going to make a big deal, so I'll just eat whatever I want. But yeah, definitely can have a great impact on one's health and recovery.
Yes, it can. And there are studies out there showing that diet can influence in a positive way Hashimoto's. Because I did
Yeah.
a lecture on it to conventional doctors on Hashimoto's and integrative treatments. And I dug in and I found all those studies, and I'm like, you can't refute this. Like, you just can't, because the
Yeah.
studies are there. So it is frustrating. I don't know. I don't know if they just stop reading or they just don't have time to talk about nutrition, but definitely it's the cornerstone to healing autoimmune disease. Um, so what are some of these different treatments for Graves? And tell us about what you personally did in 2008.
Sure. So again, as I mentioned, anti-thyroid medication was given to me as an option, and I wasn't completely opposed to taking it. If I absolutely needed to, I would. But I took a couple of herbs. So one herb is called bugleweed, and that's an herb with anti-thyroid properties. And so I started with the bugleweed, and it worked wonderfully. Within a few weeks of taking it, I noticed my heart rate was decreasing. Even before doing blood tests, that's how I knew it was working. I was still having some heart palpitations, and so I added another herb called motherwort, which focuses more on the cardiovascular system. I think of it more as a natural beta blocker, even though, of course, the mechanism is not exactly the same. But so I was on bugleweed, I was on the motherwort. There's some people are on lemon balm, which I did not take at the time, just because I wasn't familiar with it. But lemon balm is also an herb, and that has a calming effect, and it's not the same as bugleweed, but again, a lot of people, it could help with anxiety, could help if they're having issues with sleep, depending on the cause of the sleep issue, and L-carnitine. So L-carnitine there's a few studies showing L-carnitine tartrate in higher doses, between 2,000 and 4,000 milligrams per day, can block the entry of thyroid hormone into the cell. So that also could be beneficial in some cases. So from a symptom management perspective, those are some of the natural agents that someone could potentially take instead of anti-thyroid medication. I'll say that the one, I mean, there's a few potential downsides. Obviously, I mean, well, a downside of the medication is that a lot of people react to the methimazole. Like methimazole very commonly will cause side effects, and including elevated liver enzymes, and sometimes depress the white blood cells. And then other times, just not just the labs, but just how someone feels. It might cause rashes. It might cause dizziness. Uh, that being said, some people could react to the herbs. It's not as common, but you could always have a negative, like a just an allergic, an allergy to like an herb, for example. So there's that. But also, they don't work. I mean, honestly, the anti-thyroid medication definitely works better. Like it's more effective, but again, it's risk versus benefits. Also, studies have shown that both methimazole and PTU can affect the intestinal barrier, so pretty much potentially cause a leaky gut, cause dysbiosis, imbalances of the gut flora. But the problem is the natural agents don't always work. So like in my situation, I wasn't taking anything. And if someone is working with me and they're also not taking anything, and it's like, okay, let's try the herbs. It's a more challenging situation if someone is already taking the anti-thyroid medication. First of all, since I don't prescribe, I can't tell someone to stop the methimazole. But even if I could, it would be a tough situation because they might not respond to the bugleweed. So some people will actually take the bugleweed, the motherwort, maybe even the L-carnitine at the same time they're taking anti-thyroid medication. And then if they start becoming hypo, then they could go back to the prescribing doctor and get the whatever they're taking, methimazole, PTU, the dosage decreased of that. But yeah, so that's pretty much the symptom management aspect when it comes to hyperthyroidism Graves. And then as far as other treatment options, really depends on the functional medicine testing, what we see with the testing we do, whether we do an adrenal saliva test or a dried urine test like the Dutch test, a comprehensive stool test, an organic acids test. I'm not saying everybody needs all those tests, but that's part of the health history that we all do, is just to kind of get an idea of what testing someone will need. And then based on the findings of the test, that we use those to try to find the triggers, the underlying imbalances, and then base our treatment off of those.
Yeah, and what you were saying is sometimes patients are on the medication and then you put the herbs in. And I've had a few cases where we had to do that, and then we would just drop down on the medication as we were working on the root cause, whether
Yep.
it's infection, parasites, leaky gut, and then they could come off of it. So it's you have to tell the patient, if you start feeling hypothyroid symptoms, decreased energy, gaining weight, constipation, we can get more blood work right away and check that, but also, be aware we don't want you to swing back the other way if they're on that medication. The herbs in
Yep.
general, though, it's not going to like force things as much as the medication that
Exactly.
I've seen. Yeah. And we see that because, God gave us botanical and herbs, and, medication is beautiful when needed, but botanicals are a little bit better because they're working with your body as opposed to that medication that kind of forces its way in there.
Yep.
Right. So, I think that's great that you were able to manage all your symptoms with just the botanicals and herbs while you were working on your root cause.
Yeah, and there's also, it's worth mentioning, I mean, there's no magic supplements out there that works for everybody. And usually you got to do more than take supplements, but there are some great supplements like selenium, very helpful for both Graves and Hashimoto's. And there are numerous studies showing that selenium can help with thyroid antibodies. Now, again, if you just take selenium and don't do anything to address the underlying cause, it's probably going to have minimal effect, but it can help to decrease oxidative stress. We both know how important vitamin D is, which is more of a pro-hormone than a vitamin, but still you could easily test for vitamin D in the blood. And then if you're deficient, I mean, obviously try to get as much sun as you can safely get as much sun as you can. And then just also might need to supplement with vitamin D, which I need to do because quite frankly, I don't get as much sun as I probably should be getting. And then even if you get regular sunlight, I have people in Arizona and Florida and sunny areas who are low in vitamin D. Now, part of that might be because if you're in Arizona, for example, and if it's in the summer, you're probably not outside because it's so hot. And even in Florida, that could be the case too. But so even if you're living in a sunny area, or even if you're living in a sunny area where it's not that hot, but you get a regular sun exposure, you might still be deficient, or maybe you're within the lab range but less than optimal. I mean, that happened recently with my wife. She got vitamin D, and she was taking it for a while. She's, for whatever reason, stopped taking it. She had a blood test done. Her vitamin D was in the 30s, and the doctor was like, "Oh, that's fine. Everything's fine." And I'm like, "No, you really want it above 50. Some will say even between like 60 and 80, but I don't like to see it lower than 50." So the medical doctors still are recommending the lab ranges, or at least many of them are, unless if they have a functional medicine background. But yeah, so vitamin D, selenium, omega-3 fatty acids. I can't say I have everybody do a fatty acid panel, but if someone does a fatty acid panel, and if they're not taking a fish oil and they're not eating fish regularly, they're almost definitely going to be deficient in omega-3s. So yeah, those are some of there's definitely, all the nutrients are important, of course, but those are three that I wanted to mention here that are really important.
Yeah, absolutely. And with regards to the omega-3, we have an abundance of like seed oils and omega-6 like that sneak
Yeah,
in to the diet. So you really want that omega-3 level to be adequate to balance that out. And that can be difficult.
exactly.
Yeah, even if you just eat out occasionally, it's like, oh, this probably has seed oils in it. And
Yeah.
I'm like, ah. Anyway. Um, what did you find out was your trigger when you were diagnosed in 2008? Did you find that out?
Definitely stress was a major factor and major trigger. One thing I didn't mention though with the stress, emotional stressors were big. My adrenals, at that time I did an adrenal saliva test. I don't even know if Dutch was available then, but my adrenals, everything was low. Cortisol was low, DHEA was low, secretory IgA was measured on that test. That was low. But I was also overtraining. So when I mentioned I was dieting and exercising, I was definitely overdoing it. Now, I didn't realize at the time, even though I should have with my background, but still I wasn't listening to my body. And I'm sure that also played a role in how bad my adrenals looked. And then also what's interesting is when I was taking a natural treatment approach, there was no autoimmune protocol back then, no AIP diet back in 2008. So I was just following, for the most part, a regular paleo diet. I wasn't eating eggs just because, at least back then, I wasn't a big egg person, but I was eating nuts and seeds on a regular basis. And I kind of hit a roadblock in my recovery. And I didn't know if it was the nuts and seeds, but I decided to take a break for a few months. And then maybe it was a coincidence, but after eliminating the nuts or taking a break, because I do eat them these days. It's not like I don't eat them, but back then I took a break and things I started to progress. And they definitely have health benefits. They just could be a little bit harsh on that gut while healing. And we spoke about the importance of having a healthy gut. So that I think also was a factor. But in my case, definitely stress, if I had to say, was like the number one trigger that I would probably point to that.
Yeah, I love it. Well, it's interesting about the nuts, and people get confused about food sensitivities and will I never be able to eat that again? Well, if you take it out and let the gut heal, sometimes you can add things back in.
Mhm.
And that's where these food sensitivity tests, it's not like set in stone, this is what you can't eat
Yeah.
forever. It's kind of like, this is what you need to remove right now. work on healing your gut and reintroduce it, possibly later. That was me in nightshades a couple of years ago. And I just noticed that they were bothering me. And I
Hmm.
would just have them, every once in a while. And then I eliminated them for 2 months. And then now I can eat nightshades. Not that I go crazy with them, because
Yeah.
I try to do more animal based at this
Hmm.
point of my life. But that was kind of cool how you saw that, drawing back on it and then bringing it back in. And that's hard because when we have these patients with autoimmune diseases, a lot of the times, yes, gluten free, which I want all my Hashimoto's and Graves patients just to be gluten free, but the
Yep.
dairy free, because if you're dairy free and gluten free together, what are you having? Tons of nut products like nut milks
Good
and
point.
yeah, yeah, because I did a food sensitivity test on myself when I was still a little bit more dairy free. Now I do a lot of raw dairy and raw cheeses organic, and I'm fine with it. But back then, it peanuts and almonds I reacted to, and I'm like,
Mm.
oh, because I'm having so much of them, almond cookie, and you know what I
Yeah.
mean?
Yep.
So, very, very interesting. So I would love to hear your thoughts on iodine and thyroid health. And similar to what you were saying about diet and different, functional and integrative practitioners, iodine is one of those hot subjects that we all differ on.
Yeah, I mean, you're absolutely right. Iodine is very controversial, especially in the world of thyroid health. I mean, like any mineral, we need iodine. Iodine is actually important for the formation of thyroid hormone, but too much or too little iodine can be problematic. And there's resources out there that recommend for people to take high dose iodine, and then there are other resources that say you should stay away from iodine. So, I will say that my experience with iodine personally in the past was positive because when I was prior to my Graves' disease diagnosis, I mentioned I used to attend and still do attend nutritional conferences as part of my continuing education credits, and then even beyond that. But back then, again, this was even before I was diagnosed. So before 2008, there were sources saying that you should take high dose iodine. And so I can't say I haven't tinkered because I have tinkered myself with high dose iodine and I did fine. I did like a urinary iodine loading test, which did show a deficiency. But I guess once I was dealing with Graves, I was recommending iodine, and then I saw some people didn't do well with iodine. Again, not as some people did fine, but then I became more cautious over the years just because you just don't know how someone's going to respond. And so I can't say that I have people these days, do the iodine testing and then supplements if they're deficient. When it comes to food sources, even that I'm a little bit cautious. Like as far as like sea vegetables that are really high, like kelp, I would recommend maybe not eating that while healing, even though again, some people are able to. And I talk about this in my book, The Hyperthyroid Healing Diet. I also talk a little bit about iodine in my book, Hashimoto's Triggers. So again, if you read those, you'll see that I'm not anti-iodine. I'm just cautious about iodine. But then, like, I'm not concerned usually if someone's taking a multivitamin with some iodine, or again, if they're getting iodine from other sources, like eggs are a source of iodine. And I mean, so I'm not extreme where some people are pretty extreme, especially with hyperthyroidism, where they'll say you need to avoid like all sources of iodine. So I think in moderation, and for most people, it's okay. But as far as like taking separate iodine supplements to that, or doing urinary tests, and then if it's deficient, taking high dose iodine with separate supplements, that I would say be cautious about, because I'm not saying there's never a time and place, but it can, in some cases, cause problems.
Yeah, absolutely. It's a difficult subject, and this is where you kind of brought the point. Once again, it's personalized, right? It's not like everyone needs to follow this. We need to look at the individual patient. So,
Exactly. Yeah.
oh, awesome. Well, Dr. Eric, thank you so much for sharing your personal history of Graves and So many good pearls today for those that think they might be struggling with an autoimmune thyroid disease, and especially those that are dealing with Graves, because there isn't as much like information out there, right? Because it isn't as common as Hashimoto. So sometimes Graves patients, they just kind of get swept to the side. So this was such a great informative conversation. How can everyone listening out there, how can they find you?
Yeah, thanks, Dr. Jen. It's been great having this conversation, and yeah, people could find me on my podcast, which you've been a guest on. So it's called Save My Thyroid, and they could visit their favorite podcast platform, or just visit savemythyroid.com and click on podcast. I actually have another website. So savemythyroid.com is like 3.5 years old. My original website from 2010, naturalendocrinesolutions.com, has hundreds of articles and blog posts. But when I came out with the Save My Thyroid podcast, I'm like, Save My Thyroid is so much easier to remember. So I need to have a savemythyroid.com website too. So I have two websites, and then the books, as you mentioned, three thyroid health related books that they could find on Amazon. And yeah, those, I mean, I have a YouTube channel as well called Natural Thyroid Doctor. And so yeah, those are some of the main places people could find me.
Awesome. Well, thank you so much. It was great talking to you today.
Thank you. Thank you so much, Dr. Jen.